All right, welcome to another episode of Beyond the Policy here with Comfort Insurance. I'm here with my co-host Josh Amador, and we have a special visitor today. Actually, it's Alexandra. She's actually the COO of Comfort Insurance, and I wanted to ask you a little bit more about what you do at Comfort, and once you answer us that, I got a little more questions for you.
Okay, well, my name is Alexandra Cruz. I do a little bit of a lot in the office, mainly handle everything that has to do with operations, making sure the office runs smoothly on a daily basis, handling all the administrative tasks of the office. I oversee mainly the administrative side of the office in terms of all the employees, whether that be HR, agent support, accounting. So my main job or my main goal in the office is to ensure every department in its office is running at its best and most efficient capacity to ensure that overall our growth is substantial and that our employees have the best tools they need to succeed.
I like that. Thank you for that. Appreciate it very much. And how long have you been with Comfort Insurance? When did you start with Comfort Insurance?
So I started back in right before OEP of 2018. So I've been with the company for a few years now, actually, close to 6 or about to be 6 this year.
6 years.
So yeah, I've been doing this for some time now. I've been in the insurance industry since 2012, actually.
Okay, so you got time in the game.
Yes, so over 10 years in the insurance industry. But with this company, I've been here for almost 6 years now, and it's been a lot of growth, and being able to oversee more employees on a daily basis has been really fun too. We started off with maybe like 3 people, 4 people, if that, and now we have about 20 employees. So that's a goal, and that's a big accomplishment for me, at least in my department.
I absolutely agree. I don't want to say that I'm correcting you there, but I want to let you know that we did in reality start this with one, and then we decided to grow this into a team effort. So,
yes.
I appreciate you managing the team, this crazy winding road of insurance. I'm sure that the changes that have been coming into the industry have been driving you wacko. With that, I actually wanted to ask you, it's Women's Healthcare Awareness Month, so we wanted to bring you in and ask you a little bit more about healthcare, your experience on it, and since you manage a big organization that deals with health insurance, I want to get your insight. How important, or before we get into there, how important is preventive care for a woman?
I mean, I think it's everything, starting with the fact that a lot of preventive care for women stems from like birth control, right? Okay. So we have access to different types of birth control, but for me as a mother, I think one of the best ways that we get the benefits from preventive care is through being able to have access to doctors, to OBGYNs, when it comes to breastfeeding support, counseling, doctors who can assist you when you have newborn care, making sure your pap smear on an annual basis is negative and in the clear. So I think being able to have access to all of that, have access to all those doctors, be able to get checked on an annual basis using the health insurance is extremely important, especially for women. There's women that deal with, breast cancer issues and cervical cancer issues, women that deal with, pregnancy or infertility. And I do feel that, at least for me, it's helped me to make sure that all of my health issues or my necessities that I need as a woman are in line, having access to that.
All that stuff is, cancer more than anything. You said the C word, so that is also hereditary. So preventive care, I mean, Josh will talk a little bit more about that here. How have you seen that hereditary, illnesses have impacted our clients?
I did see how there is a gap in how women after birth, these are the stats that I looked from the CDC, the women after birth, obviously the older they are, the more likely they are to pass away, and specifically minority women are more likely to die as well after birth, if they're older and if they're Black or Hispanic. And so that's alarming, obviously, and I think it has to do a lot with different resources that are provided or the help that is in these communities. And I think we have come a long way. Our society has come a long way to be more inclusive, but I think we still have a long way to go.
And preventive care plays a big part in that, because I mean, if you catch something while you're doing your preventive checkups, you're catching it early. So that's why we're touching this topic. We want to make sure that you women are taking care of yourselves. This Women Healthcare Awareness Month. We want to make sure that you're taking care of your bodies, you're taking care of your future, you're taking care of your children, because your children are not going to function if you're not around. So with that, Alex, if you could, well, not necessarily what you've done, but do you know the preventive care that's 100% covered by insurance? Do you know what preventive care is 100% covered by insurance?
So for sure, your physical annual screen and wellness checkup, that's always 100% covered by health insurance. It's always the physical done once a year, where you go see your primary doctor. And they basically check you for everything. You'll get your pap smear done for women over, I believe it's 45. You also have access to getting a mammogram done. Again, you have access to birth control, full birth control. You have access to making sure you get your pap smear done on an annual basis. All of those things are preventative care that are covered 100% by insurance. I recently just had my annual done, and you even get blood work, all the diagnostic testings that they do to ensure, from A to Z, you get run a full panel that you're covered, that I'm okay. And I think, the word itself, preventative, right? It's to ensure that you're okay, that you're fine, and that you're taking care of yourself before, or preventing, right, before something greater or a bigger issue is at place.
Absolutely. So I want to take a minute to talk a little bit more about that. It's preventative care, right? Make sure to prevent emergencies. Make sure to prevent you from visiting the emergency room. That's what the insurance companies want to do. They rather use have them spend a couple thousand on preventive care rather than have you spend hundreds of thousands in case of emergencies, surgeries, whatever it may be, cancer. I don't want to go too deep into that, but I do want to let you guys know is that preventive care is essential to you, your health, your family, and even your finances. We won't touch too much on that. Something that I do want to touch is why should women even take these preventive measurements, Alex?
Well, it's like I said, I think it's important for us to be aware of our health at all times, right? To make sure that there's not an underlying disease that we don't know about, or a major issue. A lot of times many people go throughout their life not visiting a doctor, not getting checked up, and then down the line they find out they have a cancer, they have a tumor, they have something in their blood, they have a disease, they have an infection. And people will live their life, not knowing this stuff. And when they find out, it's kind of a little bit too late to take the proper treatments to make sure they get better, right? And so as a woman, I think it's important for us to make sure, we're healthy for our families being safe, for our own children, making sure that, we're okay, that our health is at 100%. And that if it's not, what measures can we take? What can we do to get to the 100%? Whether that be a deficiency of vitamin D, okay, I have low vitamin D. I gotta go to the pharmacy and get me a supplement for that, or I'm suffering from anemia. What can I do to make sure my hemoglobin is going up? But we won't know these things or these type of things without getting checked, right? We're not doctors. I don't know if something's wrong with me unless I go get checked by a doctor. And so making sure that you're at least doing it on a yearly basis, getting checked, on an annual basis, getting your physical done on an annual basis, your blood work, I think that it's extremely crucial, just to make sure, you know, there's nothing else going on. You know, you touched upon the hereditary aspect, and sometimes we don't even know our own genetics or what our family has had in the past.
True.
And then maybe my mother suffered or my grandmother suffered from diabetes, and I never knew that. And then now, you know, I'm very, very close, or I'm very pre-diabetic, almost there. And getting checked up, you know, will make sure that in the case that there is an underlying issue, cause, or hereditary genetic component, you know, we catch it with time and make sure we take care of it.
So I'm hearing you talk about this, and I'm like, oh yeah, there's two things that are for sure in my family. Number one is we're hereditarily short, number one. And number two is, yes, we have a history of cancer in our family, so preventive care is absolutely important, absolutely essential in your daily life and in your growth, in your future, and for your family. So please, if you don't have health insurance, number one, get some health insurance. You already know where you can get it. Comfort Insurance, it's in our name. That's what we do. So you can get it over here. And make sure that once you have that health insurance, you know, go get your preventive care. You won't have to pay for it because it's 100% covered. All right. So I'm gonna touch some HIPAA disclosures. I just want to make sure that everybody out there knows that you know, we're not out here sharing people's information. We're not out here sharing people's scenarios. And the only reason why we are sharing this in your particular situation, Alexandra, is because you know, it's Women's Health Awareness Month. So what we want to do is make sure that the women out there know and understand what's available to them. When was your most recent health insurance interaction?
2-3 weeks ago, I did get my annual done. I'm pretty good about trying to make sure that I at least go once a month. You know, I have health insurance, and so I think it's important that if we have it, we use it. So I did get that done a few weeks ago. I got a full physical done by my doctor, by my primary, and she also took blood work. Last week I actually had my follow-up call where she kind of went through my whole entire panel one by one. Kind of told me, you know, if there was anything abnormal. Thankfully there wasn't, and so, you know, I'm grateful for that I have the access again to be able to get those results and have that and make sure that, you know, everything with myself is okay. Back in March, I had another interaction with actually an orthopedic doctor. So I work out a lot. I actually like to run, so okay. I go to the gym. I like to run. Right. Unfortunately, I kind of had to stop that in the last. So while I was running, and like I said, I run hard. I kind of seems like I pulled something on my hip. I thought it was my hip flexor. Turns out I actually have a tear on my hip lateral something. I don't know the exact words for it.
That sucks, dude. You were working out, trying to keep yourself healthy.
Yeah.
And you ended up actually using your insurance because you got hurt working out.
Yeah. So I went to orthopedic. They ordered an MRI. And in the MRI, they were able to see that I do have a small tear, nothing crazy huge. And, you know, next steps from that is I have to get therapy done, like so physical therapy, have to possibly do some plasma injections, all things that, you know, my health insurance will be covering, you know, a portion of it. But it's safe to say that at least I know I have health insurance, that I was able to get that checked out. I was able to get my MRI done, and now, you know, be able to do treatment to make sure that I can get that repaired and get back on track to running again.
Yeah, for sure. I've actually seen what an MRI costs, and it's $1,000 plus. Okay, it's $1,000 plus.
That's very true.
So with that, I can tell you that I know that you're saving a ton of money simply by just having the health insurance.
Yes.
Now, with that said, what is your experience with health insurance?
Overall, I can say I've had a great experience with health insurance. You know, there is always those minor issues or inconveniences where
what do you mean?
Sometimes, you know, that you'll need like an authorization and the doctor doesn't want to see you, or they might bill incorrectly and they might be telling you, hey, this is not covered. But those are all things that, you know, a lot of times happens just for a lack of miscommunication. I've always seemed to be able to get everything in order and everything fixed just simply by calling the health insurance, calling the doctor, making sure, you know, billing codes and my benefits are being covered. That's always one of the things I do like to ask too before I go to a specific provider. Make sure that they do work with my insurance and that the type of care that I need is being covered by the health insurance. But overall, I mean, I've been able to say that I've remained healthy thanks to health insurance. Like I said, I get my yearly checkups done, and even when I've had foot surgery, now this issue with the hip, all of that is being taken care of by my health insurance, and like you said, the cost is just very, very minimal thanks to health insurance. So I am very grateful. I think overall it's been a grateful experience to feel that I'm safe because I have access. And like Josh has said earlier, you know, we've come a long way where we now have all the resources, the access that, you know, our government is able to provide, that the carriers are able to provide, to ensure that, you know, the death rate is significantly low than it used to be in the past.
Wow. You shared a lot there, and something that I do want to emphasize is the importance of even having the insurance, and then once you have it, use it. Okay, it's one thing to have it. Another thing is to take the 2 hours that it's going to take to go to the doctor's office, get your blood work, get your tests done, and in a couple weeks, maybe a couple days, you'll have your results. So I appreciate you sharing that with us, Alex. I appreciate all the hard work that you do here at Comfort Insurance, and I'm sure that everyone here also appreciates all the insights that you gave us. All you guys definitely need to know what type of coverages you guys have. You want to be informed of what type of coverage you have, what your coverage excludes, and the limitations that you have. Most of our coverages, honestly, they come with like benefits of like $20 million, sometimes unlimited. We appreciate the time that you gave us here, Alex. I don't know if you have anything else to add. Maybe Josh, got I don't know, comments, insights?
I'm just wanted to ask you, you know, based on just putting it all together, what's your favorite part about one, being a woman that has a lot of responsibility? What's your favorite part of it?
The part where I get to be some type of inspiration and role model to other people around me. I think that in the recent months, I've seen tremendous growth in my own people, right? And I think that goes both ways, both in my children, right, that I can inspire and be a role model, show them, help them grow, but then also here in the work field, in my professional area, where I'm helping others grow alongside me, being able to get in the knit and the grit of our daily work, day-to-day responsibilities, but work alongside them. I think that that's probably my favorite thing, to be able to teach them, but also learn from those around me. So I enjoy doing what I do.
Oh, wow.
I really do.
I felt that answer too. So I wanted to touch the last question that she answered. The question was, what is your experience with health insurance? And she says that she's grateful. So in my 10 years of being in this insurance industry, I've never had anybody say that they're grateful. So that's definitely something that's going to stick out with me, and I'm definitely going to remember that. And with that, I mean, we are grateful for you sharing your experience, sharing your thoughts, and sharing your time with us. We greatly appreciate it. Thanks for coming to Beyond the Policy with Josh and I.
Thank you for having me.
We'll have you again,
Yes.
hopefully soon.
Thank you for having me.